Women themselves have said they want to be seen as a whole, not to be seen in parts, not to be seen just during reproduction. And so for us, it's about investing in health and information as what we've heard from women and girls, ensuring that during menstruation, during the years pre-conception, we respond to their needs. During the time that they are pregnant, we respond to their needs. But even after, because their lives don't stop with only pregnancy and childbirth, their lives continue. And really issues to do with menopause, postmenopause, how to deal with some of the chronic diseases, issues that come with menopause like osteoporosis, the issues that come with the low estrogen levels in the body, low hormonal levels in the body. Women need to understand that so that they can be able, and not just the women themselves, even the system. Employers need to understand when a woman is going through menopause, when a woman is going through menstruation, there are some things that affect our inputs and outputs. This report in our lifetime is a diagnosis to the system. It is basically really laying bare the truth and the reality that whatever is being offered by the supply, what I call the supply side of the care, the practitioners, the programmers, policymakers, and funders, and what women are asking for are worlds apart. So you keep on hearing women go to a health facility, but nobody's asking how are they going to get to the health facility. Women told us that we are told go to the facility, but if we go to the health facility, first, how would we get there? Who do we leave our children with? Who takes care of the need of going to fetch water at home, water access? And how comes no one sees the link between that and what I need to go and do in the health facility? So what we see as real gaps is that whatever is being programmed for is really disconnected from what women want. And so for us, this report is a bridge. We call it the bridge to the gap, because it connects the real needs to whatever the system really is looking for. So if women are asking for income, they want it not just because they just want to have income. They want to have bus fare. They want to be able to buy food for their homestays before they can leave. They want to find a place where someone to pay for childcare, the other children, before they can go to the facility for anything. They want to be able to have at least water in their homestays before they can think, so that they can stop thinking about the basic need while they are living out the most important thing, the other important thing, which is their health and their life.
I call upon all the government, I call upon the partners, I call upon the NGOs, that they come in together and support these responses of the healthcare and self-health care of all women around the world, and the young girls, especially those who are in school right now. They need sanitary towels, and that is one thing that can keep them in school.
A lot of high-level advocacy has also gone into play based on the voices and what they have said on how best they feel that they need to have a respectful care of healthcare services when they are coming to our hospitals, and also addressing some of the awareness gaps that were listed, plus also the diagnostic aspects that were highlighted. The other bits that have also been a big win is on ensuring that the economical stimulants are linked to some of the needs that the women and girls have raised to us. So part of the acting component, and this is based on the listening that we have had, is enhancing the diagnostic, because one of the few things that they highlighted, there are not enough diagnostic components, and especially for raising a lot of awareness within the chronic health space. And one of the few things that we picked up from that is that there's need for more awareness within the communities that we serve about the prevention of the chronic illnesses, and that is one of the few things that we are going to have an integrated outreach under the primary health care, where we have the spokes and hub model to ensure that we are offering adequate community awareness and outreaches across the women's health.
Kwa mambo ya afya, tulijua kwanza kama mama mjamzito, sasa anajua kutembelea clinic kwa wakati mapema. Sasa huko Masaini huwezi ngoja ujifungue nyumbani, na bado hiyo usafi tunaendelea juu ya, na White Ribbon wametufunza bado hiyo, na pia White Ribbon wametufunza hiyo mambo ya maji na kunywa maji safi.